When I'm visiting with patients that I'm seeing in the clinic, oftentimes I'm seeing them for regarding their chronic illnesses, diabetes, COPD, CHF. But in conversation, we may have some social needs unmet that we're starting to talk about, either financial issues, transportation issues, not being able to get to a specialist that maybe the doctor has referred them to, and other miscellaneous bills. They might mention electrical bills and they're on a limited income, and just kind of an assortment. Sometimes people are like, I can't afford to buy nutritious food because now that I'm learning about diabetes, I'm being told I need to eat better. So, if I don't necessarily have the answer, I know Dallas County Public Health Navigation Team has access to a lot of different programs. I have 2 patients, elderly, and we're looking to get signed up for Medicare and really didn't know where to go and who to talk to. So I referred them. So sometimes it's not a really big fix, it's just a small fix, and it takes some of that pressure or frustration or worry from that patient, and then they can focus on maybe working with me with their chronic disease. The other thing in our clinic is also me working to encourage the nursing staff, to empower them, to let them know they don't necessarily have to have a doctor's order to send a referral. It's not based on a doctor's order. If they have a conversation when they're rooming a patient and the patient brings up something that they think maybe the navigation program can assist with, they can send a fax. They don't have to have a doctor's order. And that, I think, makes it even more appealing to me that the nurses can have some autonomy and provide the help.
I think when I first started off with coming into the home, we were thinking that maybe you were trying to see about your health insurance and where all that, where it was at. And in the discovery that there were other things that we found that you could also take advantage or utilize in services. Do you want to share just a little bit of the experience, Jeannie, and what it's been like?
Well, the main thing was that I had a fire in my kitchen 2 years ago, and I only had 2 years on my insurance to get all that done, taken care of, and turned into the insurance. Well, you can't do that when you're by yourself and you can't walk well, can't breathe. Get someone to help me empty out the kitchen. But I was at a point where I really couldn't ask anybody for any more help because I couldn't stand to fill out any more papers. I just get like a nervous wreck when I do it, and then I just can't do it. So if Vivian hadn't been able to help me do paperwork, it just 195,000 pieces of paper, I would have never gotten anywhere. Well, and I have a problem with talking because I've had 5 strokes, and when I can't remember, it's just gone. And she always seems to know what I need to say. And when I need a ride, she helps get the bus here. And I have a car, and I should be able to drive, but I can't drive because of all the medication I'm on. Like 20 of them.
Now we got that figured out with the Medicaid application. It's been processed, and that was kind of a good thing for you because that'll allow you to access some other services. So I think what you've covered so far, I mean, that's basically what I've been able to come into the home. As Jeannie mentioned, that with her health barriers that she has, I've been able to come and connect her and to the resources that are available to her that she wouldn't have been aware of other if I wasn't able to come into the home. So I just want to thank you, Jeannie, for allowing me to do that and be a part of getting you connected and helping you out in that way. So.
And not as anybody, thank you for everything you do. I mean, I just couldn't do without her.
Oh, but you can, and you have,
No.
and you have. So she's able to get to her doctor's appointments now, and she's following through with that, and that's been a really, I think that's been an important piece to part of her quality of life, her health.
My kitchen's about done, so then I can transform my living room back into my kitchen.
Okay, great.